Good evening and welcome to week 9 of the live interactive session of the Fabrication Techniques for MEMS-based sensor, a clinical perspective. The course instructor is Professor Hardik Jitendra Pandey of IISc Bangalore, and I am the teaching assistant Vikas Pandey from IIT Jodhpur. This is a brief about me. So before we move further to questions, if you have any doubt or any section you are not able to understand, you can ask. We can discuss about it and then we can proceed to questions. Any questions?
No, sir.
No. Great. So moving forward, let's come to question 1. In order to distinguish healthy heart from irregular beating of the atrium, the diagnostic tool containing electrodes for electrical mapping of the heart signal is atrial fibrillation, electrocardiogram, electroencephalogram, or echocardiogram. What should be the correct answer?
It's
Yes, any
electrocardiograms.
electrocardiogram. Very right.
B.
Okay. And what about this echocardiogram? Have you heard of this?
No, sir. I heard ECG and EEG. That's
Yeah, electrocardiogram is also used, but not for this. When we have to check the arterial blockage, like in the heart, and when this after the heart attack, confirmation of heart stroke or heart attack, like that is done using electrocardiogram, echocardiogram. So, as we have seen that for a normal heartbeat, the sequence will be very periodic, whereas for an sorry, for an atrial fibrillation, the sequence will be irregular, like in the lower maze, and it is done using electrocardiogram. Wherever we need to check the electrical signals, we go for electrocardiogram. How the electrical signals of the heart are working. Okay. So the non-ionizing radiation used in ablating the tissue is infrared, radio frequency, microwave, or X-ray.
radio frequencies.
Radio frequency. And what is this ablation or ablating?
The burning of the tissue.
Burning of the tissue, burning or killing, we can say, and creating a lesion where the electrical signal cannot pass through. Or we are saying that we are creating a hurdle for this electrical signals.
Sir, I have a doubt. If you ablate the thing, maybe it generates some other problems to the heart.
Yes, it will certainly like we are if even if you are manipulating a bit or like if you are going for any kind of surgery after that there certainly will be some problems. And in this case, like as sir has also discussed that generally it can reoccur also. That is one problem if it is not perfect, as well as some other problem like if it is not done properly or if some other if it is done more than required or if it is done less than required, it will cause some problem. And as well as for the normal functioning, it will cause problem. But since it is already working abruptly, like out of the way, not the normal one, so we can compensate. Like we can say that okay, if it was causing like maybe it was causing 80% problem, now we have reduced it to 10% or 5%, something like that. So it is compensated by saying that it is not a
Okay, sir.
very perfect way. Like suppose we could have been able to control that signal itself, it would have been much easier instead of killing the tissue or creating ablation and these things. So it is radio frequency. Microwave and X-rays we cannot go for because they are having very high energy, and infrared is having low energy, as well as like the heating effect of infrared will cause other problems, and we will not be able to do since we are in a liquid medium. So radio frequency is preferred. Like we have seen that there are different ways: cryoablation, laser balloon catheter. Yes, you are asking something.
No, no, sir, no, sir.
And then we have standard RF low power and cooled RF high power. Why cooled RF high power? Because when we cool, we can go for higher power. We can, but for a standard RF frequency, we can go for low power only. So the answer is radio frequency. Okay? Sorry, I will just a minute. Yes. So yeah, next question. Which among the below sensing parameters, when integrated with cardiac ablation catheter, has shown to reduce reoccurrence of atrial fibrillation? So in short, we want that the ablation is very perfect. Like it is either too much nor too less. So which of the following parameters, if we are measuring along with doing the ablation, it will help us to reduce this reoccurrence? Any answers?
So contact force has to be measured.
Contact force. And why contact force? Why is it so important?
So what you said, if it is inserted inside in the heart, it will not ablate more or less.
Yes, we want a very optimized and perfect ablation so that we can control the, and that will also depend on uh, person to person, like how much disturbance is being generated in someone. Like if that electrical impulse is too much, then we will have to ablate a bit higher, and if it is less, we'll have to go for lower ablation. So it will very much depend on the input from that also, uh, ECG and other sources, as well as according to that we will check the contact force, and that is how we will determine that it is a perfect ablation and the reoccurrence can be reduced. It cannot be ruled out at all, but yes, we can reduce. Okay. The surface profile, such as roughness of a fabricated MEMS space sensor, can be understood using scanning electron microscopy, atomic force microscopy, transmission electron microscopy, or Fourier transform infrared spectroscopy.
Atomic force microscopy, sir.
Atomic force microscopy. Why not using SEM, scanning electron microscopy? Though, like, if we see the working principle of atom, if we see it like this, left hand side, that is the scanning electron microscopy, in which electron is being used. Whereas in atomic force microscopy, we are using a tip that goes above a surface. Okay, so in case of SEM, actually we are using electron, and since electron has a uh, very small wavelength, so we can go for very high resolutions, very lower dimensions. So why we are not preferring scanning electron microscopy, and we are preferring atomic force microscopy? Any thoughts on this?
For surface roughness, you should use more area. One is at different heights. Maybe that roughness has to be calculated using atomic
Yes.
force.
The problem with SEM is that we can take a picture of it, or we can say that we can have a image of the structure and at a very good resolution, but we cannot see the ups and downs, since like we are detecting the reflected electrons only. Whereas in this case, the whole sample is physically scanned in a sense. It is physically touched and a 3D model is created out of it. And that is why we go for, whenever we know we want to go for the surface characteristics, we go for AFM. And
Sir, is it similarly like reading a CD?
mm, somewhat, but very, like this tip is very, very small compared to the,
Yes, sir. One
and
side is a
in,
laser, another one is photo detector.
yeah,
Now it incident the ray
and
on the surface of the CD, and it was
yeah.
reflect collected by using photodiode.
Yes, exactly the same thing. Uh, but here the tip is also there. Like
Yes,
you can say this portion is the same. Like
yes, sir.
the
Reflection.
surface, the surface itself is read by this laser in case of CD and DVD. Okay,
Yes,
but
sir.
in this case, the back of this tip is being read by that. The tip moves
Yes, sir.
over this.
Cantilever tip. Yes, sir.
Cantilever, yes, cantilever tip. That is, and it is very susceptible to the roughness of this surface. Sometimes it breaks if it is not handled properly. Very, very, uh, what we can say, very fragile and very sophisticated instrument. Okay, but yes, certainly we cannot go to such lower dimensions as we can go for SEM or FESEM. Okay, we cannot go to that lower dimensions, but we can have a idea of the surface. Okay, and similarly, transmission electron microscopy, that is a way where we check the inside. Here the electron, like the electrons will pass through the sample. In this case, you see specimen is the last, it gets reflected,
Yes, sir.
the reflected one is being checked here. Whereas in case of TEM, this the electrons pass through the whole specimen,
Sample.
and then we can, yeah, whole sample or specimen, and then we can check the inside of it, the internal structure we can see. Okay,
Yes, sir.
whereas in this Fourier transform infrared spectroscopy, this is very much about you can say the composition of the material, the sample. Okay, in this case, the Fourier transform of the IR spectroscopy is taken, and it gives somewhat what is inside, or what is the chemical composition of it. Like for different chemicals, we will see different spectroscopy. Okay, so we can go for, if we are talking about, actually these things will be discussed in the later uh, in later weeks. I think after 1 2 weeks, we'll see like in details. All this will be discussed in the class also. So atomic force microscopy is the one to check the surface profile, such as roughness or RMS value of the structure, or the 3D, like the 3D imaging of the surface of the device or the sensor or whatever we want. Okay. Metal such as gold are deposited for sensor interconnects and contact band. However, the metal deposition is always preceded with 10 to 15 nanometer of chrome or titanium. Why? Is it to increase overall metal thickness, or improve strength and promote adhesion, or corrosion inhibition, or all of the above?
I thought it is B, sir.
B. Yes. And like, what if we directly deposit gold? What will happen?
It will not stick to the surface, maybe.
Yes, it does not stick well. Like I tried this once, and I the device, like for one of the device, uh, when I started working, I tried this like directly going for my gold deposition, and it all comes out like in chips. It creates a chip kind of structure and comes. So it is to improve binding strength and promote adhesion. Any other metal in your view where if chrome and titanium are not available with you, any other metal which you think can be used for adhesion? Or is it chrome and titanium only?
No, sir, I don't know.
Okay.
Is there
Like,
any other metal, sir? Silver or
yeah,
something?
silver actually directly have good adhesion, and nickel is used. But nickel will not give us ohmic contact. Like in that case, when we need, sometimes we need to be Schottky contact. Like in case where we need good ohmic contact, like there should be not much resistance, we go for chrome and titanium. But many a times people need this Schottky contact, or that the current should not flow, but a voltage gradient should get created. In that case, nickel is also used, and that also have good adhesion.
Okay, sir.
Yeah. So passivation layer used in micro electromechanical system, MEMS system, is silicon dioxide, trisilicon tetranitride, or silicon nitride, or titanium dioxide, or all of the above. Before answering this, let's answer why do we need passivation layer? What is the purpose of the passivation layer?
Maybe it provides a insulation to the surface, sir.
The insulation. So the one is insulation, other is protection from external environment. Like if some humidity is there, say like when you are working somewhere, some humid conditions are there, that can create some problems. Okay. Mm. And sometimes even it is used to isolate one device from other. So which of these can be used?
Silicon dioxide is used for insulation, sir. But the
Okay.
remaining, I don't know actually, sir.
We have used silicon nitride also in one case. Remember, like
Yes,
when
sir.
we
Yes,
were
sir.
making the cantilever.
Cantilever tip, sir.
Yeah, there we even used it for this strain compensation as well
Yes, sir.
as passivation layer, and even titanium dioxide is also used. See, in all these cases, they are insulators.
Yes, sir.
Passivation layer will always be an insulator. So
Yes, sir.
silicon dioxide is an insulator, silicon nitride is an insulator, and titanium dioxide is also an insulator. So all of the above, you can go for all of this. Silicon dioxide is the most preferred one generally because with silicon it is very compatible, and silicon nitride is also fine. Like that is the most commonly used passivation layer, silicon nitride, because it has very low thermal conductivity also. Whereas in case of silicon dioxide, it has good thermal conductivity. Though it will protect, it will insulate, but it will conduct thermally well. Uh, Subculturing cell lines decreases passage number. Is it true or false?
False, sir.
False. Why?
Are shown in a diagram that how the uh, from the diagram I the cells are not increased.
Yes.
That's
Fine.
the
Like you have got the idea. Yeah. It is false. It will not decrease with passive memory. Okay. After fabricating few hundreds of MEMS-based pressure sensor, it was found that the sensing area and the electrons needs a conformal deposition of protective film. Protective film is the passivation layer, right? Or what is it? To avoid contamination. Which tool must be procured by team to realize the same? It is about conformal deposition. Uh, conformal means equal, like same thickness at all the places. So it should be a sputter tool deposition, parallel deposition tool, Teflon coating, epoxy film coating system.
these four are I don't know anything, sir.
It's
Sputter deposition.
sputtering, sputter deposition you already
Yes,
know.
sir. Yes, sir. Yes, sir. Yes, sir.
Okay. And what about this Teflon coater, epoxy film coating system?
No, sir. Yes, not here
Okay.
before.
Okay. And parallel deposition tool?
Not here before, sir.
It is kind of atomic layer deposition. This parallel deposition tool, it is something where uh, layer by layer, like one atom at a time, one atom thickness at a time can be deposited. So certainly when we want a very conformal deposition, we want a control of single layer deposition. Okay, so we can go for parallel deposition too. Okay, it is a CVD method. It is a chemical vapor
Yes, sir.
deposition,
Vapor
and here,
deposition.
yeah, like sputtering is a physical vapor deposition, thermal evaporation is a physical vapor deposition, where we have the material and we are changing the phase of the material and depositing. Like we are changing it from solid to liquid, then gas, or we are either mixing it with plasma and depositing. But in case of CVD, some chemical reaction will occur. Okay, so this is this comes under CVD and it is a ALD, atomic layer deposition. So one layer at a time, very controlled growth. So if we want a very controlled uniform deposition, so certainly we can go for single layers at once. So we will know how many layers are being deposited and they will be deposited throughout. A very good and very sophisticated instrument. It is used for single layers at once. Clear?
Okay, sir.
Okay. A part of the HVAC, heating, ventilation, and air conditioning system is uh, in a clean room that regulates particulate contamination. This is something like we have been discussing from the first class itself. That is about clean room and all. So, which of these is used to control the regulate the particulate contamination? Air curtains, HEPA filter, NEPA filter, or air distributor system?
HEPA filters, I thought, sir.
Yeah, HEPA filters. And any other filter that is used. This is the way HEPA filter is there. Okay.
Yes, sir.
It will trap the particles and all. Any other filters being used in clean rooms? You have any idea?
No, sir.
The thing is that generally we are going for HEPA filter, but sometimes when people work with some smelly things where smell is there, okay, smell also is a kind of particulate contamination. So to remove that smell, HEGA filters are used. They are an improvement of HEPA filter. HEGA filters are also used. So in general, there will be like more of HEPA filters and some HEPA filters put in. more of HEPA filters and some Haga filters put in the clean room. Cell or tissue culture in an in vitro condition does not retain their function even though the growth is in artificial environment. Is it true or false? So they does not retain their function. Is it true? Is any idea, any answers to this?
So in vitro condition means is laboratory
Yes,
conditions, sir.
yes. So do the
Not
cells
retain their
lose their
functions.
function?
False, sir.
False, because we ensure that they don't lose their function, right?
Yes, sir.
That their functions are mimicked, they grow. And how? Because we are creating a condition very similar to the natural environment in which they were.
Yes, sir.
Okay. Atrial fibrillation is a heart condition where heart beats rhythmically, electrical signals pumping into heart misfires, uneven, flopping or racing heart. Uh, Both A and B, both B and C, or one of them.
So B, electrical signals pumping into the heart misfires.
Yes, this is true. Okay.
Now uneven flopping or racing heartbeat. Maybe this also correct, right? Not
And
confirmed.
yes, and that is actually the indication that of the atrial fibrillation. Like sir said, na, fist
Yes,
is
sir.
moving in the heart kind of feeling. Like something is moving inside your heart, like near your heart, it feels like. So uneven flopping and racing heartbeat, sometimes very fast, sometimes very slow.
Yes, sir.
Like
Yes,
normal rhythm is broken. Okay. And this one is in a normal condition.
sir.
Okay. So we don't feel it like since we are accustomed to normal. So what should be the answer? B and C,
Both
right?
B and C.
Both B and C. Okay. Electrocardiogram is used to detect AFib. In AFib, the heartbeats are evenly placed and show a regular pattern. Is it true or false? I think we have already answered this.
Yes, sir.
So what is that, true or false?
False, sir.
False. Because we have seen, I think it was question one, right? That in normal case, uh, I'm not drawing it perfectly, but
It's a
something like
PQRS
matter.
waveform.
Yeah, PQRS form will be there. Whereas in case of abnormal one, it will not be evenly placed, and there can be some aberrations, and then like this. Okay. So that can be seen using ECG.
Yes, sir.
So it is false. The medical procedure to treat AFib includes catheter ablation, cryoablation, pacemaker, all of above, or only one and only A and B.
Only A and B, sir.
Only A and B. What about B?
Catheter.
C. Catheter ablation is there.
Pacemaker.
Cryo. Yes.
Pacemaker is generally used to start the electrical signals, sir. If the heart is not working with the electrical signals, we have to provide the additional electrical signals.
Additional. Okay. Yes.
Yes, sir.
But in case these two are not like it is in some advanced stage where we cannot just suppress the signal that is coming out of it, the electrical impulses we cannot control using cathode ablation or cryo ablation. In that case, we have to replace the SA node, sinoatrial node, and that is the that is one giving these electrical signals that is misfiring,
Yes, sir.
and in that case we go for pacemaker.
Yes, sir. All of them.
That is very advanced stage. If we are not able to do from this, or it is at a place like too much of aberration is there, if, like you asked earlier, will there not be
Yes.
some problem when we are going for ablation? So if we ablate, in that case the whole heart will suffer. In that case we go for pacemaker. We cannot ablate to that extent, like it is too much, we cannot ablate that much, the whole heart will itself die if we ablate that much. In that case we have to replace, we have to control, we have to replace the SA node with pacemaker. A catheter is the tool used to treat atrial fibrillation. It is used to map the electrical signal of the heart, ablate those areas that are misfiring, both A and B, neither A nor B.
Both A and
Okay,
B, sir.
both A and B. Because first it goes maps and then it ablates. So what uh, what is being generally done is that there are two probes put inside. Now some advancement has come where we can have those both of those in single, and as sir also discussed, a like such kind of structure which can open and close. Like the outer
Yes,
portion
sir.
is to ablate, and inside there is the probe for electrical signal mapping. So both A and B. In catheter ablation, the non-ionizing RF radiation is used to heat a small area of tissue that is triggering a rapid or irregular heartbeat. Is it true or false?
True, sir.
True. And that is what we are calling as ablation, right? We are hitting, and in fact, we are making it dysfunctional so that the signal cannot travel through it. No. Catheteral contact force measurement is extremely important. If the force applied by is more than the region which are not needed to be ablated also will get ablated. Is it true?
Yes, sir.
No. If the
True, sir.
force is less, then the recurrence rate would be higher. Again,
Yes, sir.
it's
True,
true.
sir.
And for effective lesion formation, that is also true, I think.
Yes, sir.
Yeah. So all of this.
Yes. D.
Okay. Now, what does the effective lesion formation do? It increases the reoccurrence, decreases reoccurrence, decrease need for reablation, both A and C, both B and C. If the lesion is effectively formed. Lesion is generally said in terms of some problem, but here we are calling the ablated area, like which has been ablated, that we are calling as lesion. Okay, so if it is formed effectively, will it increase the reoccurrence? Will it decrease the reoccurrence? Or will it decrease the need for reablation?
Decrease the reoccurrence.
Yes, decrease the reoccurrence. Any other answers? If reoccurrence is not there, certainly we will not need reablation. Is it right?
Sir. Yes, sir.
Yeah. So it will also decrease the need for reablation.
Yes, sir.
And if it is not perfectly formed, we will need to re-ablate. Like we will go for ablation again and again. So if it is formed effectively, it will decrease, not completely. As I said, like no process is yet 100% uh, effective, but yes, we can decrease.
Yes, sir.
It will decrease the need for re-ablation. So both B and C. Standard RF low power catheters are preferred over cooled RF high power catheters. Is it true or false?
False, sir.
False. Why?
In the class also, sir
Hmm.
shown
Yes, so
the
showed this,
cool.
right?
Sir.
The cool will have uh, higher impact without disturbing other areas. So we can
Yes.
go for higher power. It's like we can say like we also want it to be a very fast process. If it is covering very small area, it will take time, and the more time we are keeping a patient in sedentary state, certainly that will create more problems. The more like the best way is the fastest surgery is the best, like minimal invasive, right? So
Yes.
if we are going for some very slow process, it will take time. It may lead to some other issues also, like having more blood flow and all a lot of things are there, right? So we want fast and effective one. So high power is preferred, but high power, if it is not cooled, it cannot work. It will be too much. Okay, so it is cooled RF high power, and surface cooling prevent monitoring of lesion formation. Okay,
Yes, sir.
like and one other advantage of this is that uh, there will be no boils. Like since we are burning in a sense, right? So if we just burn it and leave it, some other problems can develop, like boils and such things can develop. So if it is cooled at that time itself, it is heated but cooled at that time. So the chances of boil formation is less. So it is false. The cooled RF is preferred, not the standard RF, because we have the cooling technique along with that. The 3D force sensor, like this one, the small sensor, for catheter force sensing discussed in class is based on capacitive sensing, strain gauge, piezoelectric sensing, or optical sensing.
Strain gauge sensing.
Strain gauge sensing.
On the
Okay.
five sides, it was strain gauges are added to the
Yes.
bead.
And
Bead.
like P dot PSS, uh, like we are creating such P dot PSS structures like this on the five sides of the, like one side is connected to this side, right? So the rest five sides we are using P dot PSS strain gauges, right? So now, which is a better material for strain gauge, metal or a semiconductor?
I thought metal is a good.
Okay. What can be the reason for using metal for good strain gauge?
When the strain is applied, the resistance maybe varies.
Here we are not talking about piezoelectric or piezoresistive material. We are talking about strain only. Okay. So remember the this gauge factor. Okay.
Yes.
So when we apply the like stress upon strain, delta delta R upon R and this thing. Okay. So in case of metal, it is less. Whereas in case of semiconductor, the gauge factor is higher. That is why a semiconductor will have will be a better material for the strain gauge compared to a metal. Right?
Okay,
Like
sir.
this is something Sir has also discussed. Just to revise that. It is based on gauge factor. If we check the gauge factor, we'll get an idea. The semiconductor strain gauges have much higher gauge factor than those of metallic strain gauges, primarily due to the like this is the expansion of the previous one. Okay, so
Yes, sir.
why
Yes,
we are getting uh, higher strain gauge in case of semiconductor compared to metallic? The reason is they are in fact internally they are piezoelectric, whereas metals they simply have this delta R upon R. Okay, whereas when it is a piezoresistive material, it will have other factors also playing a role. Okay, like inside some other piezo piezoresistive uh, what we can say piezoresistive property will also play some role in this strain. Okay, and will increase the strain gauge of the material. So which will be the correct answer?
C, I thought so.
C. Yeah. So C should be the correct answer. Okay. Okay. So these are the questions for today. Any other questions? I think we have a lot of time left today. So any other questions or anything that you would like to discuss?
Sir, can we design a microfluidic chip to test saliva?
Yes. Uh, in fact, there are a lot of there are a lot of work going on in microfluidic chip because in that case we will be able. Nowadays, what happens is that whenever we go for some test, we take out so much of blood, we take out so much saliva, urine, whatever we need in large quantity, right?
Yes, sir.
So to reduce this quantity also, because saliva it is fine, still fine since that is okay, that is not invasive, not painful. Okay, but in case of this blood and all, we are taking out. Many people are afraid of giving so much blood. Okay, so microfluidic chip are a way to go for that. But yes, I am not sure whether someone has worked in case of saliva or not. Like one, I know that one microfluidic chip for blood has been studied, in which that is able to separate the WBC and RBC in a very small chip, like this small, that can come in our hand. Like that, one drop of blood is put, and then it will separate the WBC and RBC, and it is able to count the number of RBC present there. Okay, so such
Yes, sir.
works are being done. But certainly something like that can also be done in case of saliva.
Yes, sir. Actually, I'm a research scholar at Andhra University,
Yes, sir.
and also I'm in teaching field.
Yes,
Actually, I want to do the research in this area. That's why
yes,
I was listening
yeah,
in all the weeks,
yes.
and I was collected
So
more information about that the microfluidic chips.
yes, sir. And in fact, microfluidic chip is something that is a growing research field. I can say right. A lot of people
Yes.
are working in this field. Certainly. And seeing this, I think you must have gained some insights about this MEMS sensors and all. Right?
Yes, sir. Yes, sir.
Yeah.
No, I'm also an easy background,
Okay.
but here I'm learning clinical things.
Yeah. Certainly the same thing. I am also from an like I did electronics and VLSI. Then now I am in space science, but like nowadays I think department and disciplines does not matter. they are more like we can say we have to work in different fields, right? There is no defined field for now.
Okay, sir. Thank you. Thank you, sir.
Yeah. So any other questions?
No, no, sir.
No. So that's all for today. See you in the next class.
Okay, sir. Bye, sir.